Hello, everyone. Thank you so much for joining today's session on managing peripheral neuropathy and a pandemic. We're excited to talk about the topics on today's session. And for those of you who are joining us live today, I sincerely appreciate that you chose this session over your favorite baseball team's first pitch. My name is Lindsay Colbert. I'm the Executive Director here at the Foundation for Peripheral Neuropathy. And before we get started, I just wanted to go over some housekeeping items. We are recording this presentation and we anticipate being able to send the link to you within the next day so that you can watch it again or feel free to share it with your friends. At any time during this session, if you have any questions, comments, or concerns, we encourage you to use the questions box within the control panel. Everyone is currently muted. So in order to ask questions to our experts today, we ask that you type those in the questions box and we'll try our best to answer as many as we can that are on topic. And if at any time you are having trouble hearing me, we encourage you to dial in by your telephone. You can check your email for dial-in instructions there. At this time, I'm pleased to introduce our guest speaker today, our expert, Dr. Shanna Patterson. Dr. Patterson is an assistant professor of neurology at Mount Sinai West in New York City, and she is also on the Foundation's team as our patient education advisor. So at this time, I'd like to welcome Dr. Patterson to join me, and we can go ahead and get started on the session.
Hi, Lindsay. Thank you so much. It's a pleasure to be here, and thank you everyone for joining. It's really an honor to be able to hopefully help answer whatever questions I can today.
Great. Well, Dr. Patterson, we received so many questions about peripheral neuropathy, managing your neuropathy amidst a pandemic. So kind of the elephant in the room is the vaccine for COVID-19. So what are the current recommendations for patients with peripheral neuropathy? Should patients get the vaccine?
So I think, that's a great question and one that we certainly are hearing a lot about, especially I think as with everything during the pandemic, there's so much information coming at us from so many different sources. But I will say that really, truly from a medical professional standpoint, our messaging has been really pretty consistent, which is to say that unless you have a true kind of serious allergic reaction to a prior vaccine that is known, we are recommending that people go ahead and get the vaccine.
And are there any known negative side effects for people who currently have neuropathy that would get the vaccine?
So that's another great question. And I think that, what I would say is that for many people, there's a lot of stories that we're hearing or anecdotes and so forth. But there's really, one of the things that's really interesting and challenging, and I think it's going to take time as people are talking about, well, what are reliable patterns or how can we truly attribute certain side effects or symptoms either to the vaccine or even to COVID infection itself. What I will say is that we are seeing a whole variety of different responses. Many patients have no side effects with the vaccine, even though we constantly are hearing about the side effects that can occur. Many people don't get any side effects. Some people, I think for the people who do have side effects, the most common experience is that they have a variety of side effects, whether it's malaise or a headache, other things like that, or fatigue, that last for 1 to 2 days and then completely go away. So again, this is thought to be just a reflection. And again, it doesn't mean for people who don't have side effects that that's a bad thing, but it's just thought to be a natural reflection that that's your body's immune system responding to the vaccine, which is the goal. The goal is for the immune system, of course, to respond to the vaccine so that it can help protect you. We do hear from some patients who have peripheral neuropathy that they feel like their neuropathy symptoms are worse, not that they're different in a way that they've never experienced before, but that they might feel like if they have maybe pain in their feet, that maybe it's a little more bothersome or noticeable right afterward. One of the key things that we're talking about, and I may use this word a few times today, depending on how our conversation goes, because I think it's important, is this idea of attribution. What does that mean? It means that we see patterns, but we're trying to figure out, how do we make sense of those patterns? And we think that in many of these cases that the people who have sort of feel worse than usual, but in a similar way, to their normal pain, it may just be sort of your body's version of the side effect, if you will, and not an indication that your neuropathy is becoming worse in that moment. Sort of in some ways, for example, as some people notice their neuropathy maybe feels worse under other conditions. For example, some people notice a sensitivity to cold temperatures. Some people notice their neuropathy symptoms bother them more at night. Again, we don't think of that as meaning that the cold or that night is making their neuropathy worse in that moment, but just that there's a variety of circumstances that come together and it makes it feel worse. There are very rare examples of types of immune responses that result in an immune-mediated neuropathy for patients after a vaccine. To be clear, this is with many different types of vaccine, not just the COVID vaccine, and it is extremely rare. So, and people who have neuropathy already are not more predisposed to that than anybody who is healthy and doesn't have a history of neuropathy. So there are certain types of complications that are being tracked very closely. However, patients with neuropathy are not known to be at higher risk for any of those compared to anybody in the population in general. And for the vast majority of patients so far that we've been seeing who have feeling like their underlying symptoms are a little bit worse after getting the vaccine, we think that may be most likely kind of in the realm of their side effects, if you will, and definitely not a reason to advise others to not receive the vaccine.
So it ultimately sounds, and I think we've reported this here at the Foundation for Peripheral Neuropathy for the last several months, is that it is far better to receive the vaccine because the risks of getting COVID outweigh the risks of potentially getting neuropathy, making your symptoms worse, et cetera. So long story short, get the vaccine, it's the better move.
Absolutely. And I think that conversation about risk is really important. I think that, looking throughout this pandemic, there's always a couple of different lenses. One is what can you do to protect yourself, and your immediate family, for those of us who have especially family members who may be at high risk from getting COVID. And the other thing is looking at the population as a whole. So we know, for example, that everyone's excited because at the population level, the vaccines offer the chance for us to stop the pandemic. But even, when you're looking at your own health, it's a real question of risk and saying that, what can we do to help protect ourselves? And we definitely are learning now, a year out, we have enough information to know that even though there are many people who have mild cases of COVID, there are many people who have true lingering problems even after they recover from a COVID infection, even if they're not hospitalized. And so I think that is information that we are increasingly confident in because we unfortunately have had so many cases. And I think that's the risk kind of analysis that I would encourage people to take. And the thing we also know, I know everyone's speaking about variants and so forth, especially during 2021. We do know, and data is increasingly showing, that the vaccines that we have now are for the most part effective against the variants that we have here in the United States.
And is there one brand that might be better for patients with peripheral neuropathy? Sometimes I know you don't get a choice, but is there any data proving that there's one brand better than another?
So that's another great question. And I've heard this said by different experts, and I think it kind of succinctly expresses it. The best vaccine for you is the one that you can get the soonest. There's really no, I know there's a lot of information out there again about the different brands and different, which studies have shown what and so forth. But in truth, all of them have been shown to be extremely effective at preventing hospitalization and severe COVID. And that's really like the most, if we didn't have that concern, if everyone had only mild cases, we probably wouldn't be in a pandemic anymore. So I think that's kind of a great take home to think about. I know that some people, for convenience, like the idea of having one shot versus two and different things like that. I mean, that's okay. That's kind of a personal choice. But if you're really trying to think about, is there evidence that one is better? I would say the one that you can get is the best one.
Sure. And is there any evidence that the vaccine has any more or less efficacy for people with peripheral neuropathy or others with underlying conditions that might be neurological or otherwise, with respect to just protection?
So I think that one thing, in general, for people with different types of illnesses or neurological illnesses like neuropathy, there's no information that leads us to believe that these vaccines are less effective. The one trend that does not apply to most people with peripheral neuropathy, but for some it does. So for some patients who have, in terms of peripheral neuropathy, rare kinds of autoimmune peripheral neuropathy who require chronic immunosuppression, there is some thought that it may be the case that if your immune system is suppressed, that it may not mount as bold a response with the vaccine as for somebody whose immune system is not suppressed. And that may just be a natural function of the treatment that you need for your condition. So I think, we still are learning about that. And the recommendation is still for sure to get the vaccine for those patients. I personally think that those patients, who have a variety of different serious autoimmune conditions, not just neurological, those are probably patients who I feel like throughout the pandemic have been extra careful and taking, precautions across the board. So I think this isn't any different, and I don't think this is a reason to not receive the vaccine.
Great. So we've heard some patients who have mentioned to us that their symptoms, their neuropathic symptoms, have gotten worse after the first dose, and they were trying to figure out, should I get the second dose or not? I'm nervous about getting that second dose if I've already seen a flare up after the first one. Do you have any thoughts or recommendations for people that have had those types of complaints or concerns?
Absolutely. So I think, one thing I would certainly recommend is speak to your doctor, speak to your, if you have a neurologist, ideally speak to your neurologist to partner with them on that. As I mentioned, I think that for many people who have that experience, if it's a sort of a fluctuation within a pattern that you notice in general, otherwise, if it's a little bit worse some days and a little bit better the other days, and after you have the vaccine, it may be a little bit worse for a day or two, I think that people would probably agree that's not something to be definitely concerned about. But if there's, I think for different patients, people feel anxious. That's where I think partnering with your doctor, your neurologist, if you have one, is really important. Maybe they'll be able to do a physical exam. Maybe they'll take a look at, getting some EMG data to compare, just to provide reassurance that, okay, we don't see any signs that things are really worse. We don't think that there's any risk. And if, it was symptoms that, were transient and so forth, then we would say that it's, we're comfortable going ahead. Of course, it's a personal decision, nobody's mandated. One of the, things that I think is great to at least know is that for those vaccines that do require 2 doses, there's more information, at least in the short term, that we find that even if you have 1 dose, that's very effective, even provides some protection. So I think, we are stopping short of recommending that people definitely, stop at 1 vaccine. But what I would say is it's hard. I think people feel uncomfortable when they feel like their symptoms are getting worse, regardless of what the cause might be. So I would say, certainly you don't have to do this alone. You don't have to try to figure out everything. It can be, there's a lot of strange misinformation that's also floating around in different areas online and other media. So I would certainly encourage people to reach out to a trusted source, reach out to your neurologist or your doctor if you have any of those concerns. But for the most part at this point, we do not have any information that would suggest that there's, for across the population, a concern that would lead us to recommend that people not get the second dose.
And kind of along those same lines, it sounds like there might not be enough data to suggest that the symptoms, that the heightened symptoms that one may or may not be experiencing will last or will stop at X date, right? We still, is that a correct assumption, is that we still just don't have enough information to truly understand if you're the patient that has worsening symptoms after the first or second dose, you want to know, is this going to be the rest of my life, or is this going to end at some point? And if so, when? Do you have anything to share specific to that?
No, I think it's, I think it's a great point. So what we certainly see independent of neuropathy is that for most patients who have kind of the run-of-the-mill common side effects, whether it's a low-grade fever or headache, fatigue, body aches, and so forth, those symptoms really follow a very distinctive pattern of coming and going within 1 or 2 days after your vaccine. And many people who even have significant side effects like that, which we consider normal, feel all better pretty much after the 2 days passes. For the neuropathy symptoms, those are less common. And so I think it's hard to put everything into a sort of a guaranteed kind of package and say we guarantee or we fully expect this to go away by this point. And I think as many people notice, sometimes neuropathy symptoms for patients, especially who've had neuropathy for a long time, have probably noticed that sometimes it feels like it's getting worse and you're not sure why. And sometimes when you see your doctor for an exam or other testing, it's not actually physiologically worsening, but it definitely feels worse. So I think that this may be kind of part of that same, gray zone, which is uncomfortable. But again, that's why I think that it's important to also not enter into the situation feeling like, that something is really dangerous, because we do not have any evidence, as you're saying, that there's any danger here. And I think also feeling comfortable that you're not alone. If you do have questions or worries, please reach out to your doctor to discuss it.
Yeah, and I mean, to your point, there's so many different factors going on, right? You might just be having a bad day because you're having a bad day, and it just might also have coincided with one of a recent vaccination. So not trying to dismiss any of the concerns that our patients have raised, but I think there are a lot of factors. So I think, to your point, just suggesting to get the vaccine and hope that whatever worsening symptoms you have will hopefully kind of roll off at some point. Do you have any suggestions on what people could do before or even after they receive the vaccine to maybe reduce or prevent side effects? Or is that kind of an impossible thing because everyone's body responds differently no matter what you do? You could drink water, not drink water, take a shower, take a bath, go for a run, sleep all day.
No, that's great. I think that so first of all, it's really funny, and I think having had a lot of colleagues certainly who've been getting vaccinated and patients who've been vaccinated, it really is this kind of funny superstitious thing, if you will, where some people are just so sure they're going to get horrible side effects, then they have nothing, and sometimes it's vice versa. So I think there's definitely nothing that we are thinking about that if you do this you'll prevent, you'll ensure a certain type of outcome. So one thing that I do say to patients is, okay, for one, if you think that you are planning a really busy day, personal with appointments or a lot of work meetings or something, I wouldn't plan that the day after the vaccine, because just in case you need a little more time to rest, it's nice to kind of give yourself that flexibility.
Right.
So that's one thing I recommend to people. And then if you feel great, then fantastic. But at least then if you need some more time to rest, you've kind of given yourself or tried to give yourself a little bit of some space to do that. That would probably be the biggest thing that I would say. Otherwise, I know some people are concerned, and I've seen this come up in different venues where people are concerned about, what if I take Tylenol or Advil, if I do feel like body aches or a headache, am I sort of suppressing my immune system and preventing a response to the vaccine? And the answer would be, if you really, I would say the answer is truthfully no. That, for one, we know that people who take Motrin or Tylenol, Advil, other things like that for aches and pains and so forth, routinely for a lot of different conditions, do not have compromised immune systems. As a result, we don't hear about people who have compromised immune systems because they've been taking Motrin or Advil. So I really wouldn't worry about this. And even if you look at the CDC website, they do say, that it's important if you feel like you need to afterwards, or if you have a low-grade fever, if you feel uncomfortable, that it's okay to go ahead and take one. The most kind of micro-analysis discussion I've heard on this, some people who were like a panel of physicians debated among themselves, and they said, okay, well, maybe, if you want to make yourself feel better, don't take it before you get the vaccine, but maybe wait and see how you feel. And then if you do feel like you need to take something, if you have a headache or you have some body aches afterward, then go ahead and take it.
Sure.
You know, I'm not sure, honestly. I think this is probably a microanalysis and there's probably not a significant effect there, but maybe make sure you have some Advil or Tylenol at home in case afterwards you feel like you need to take some.
Yes, and don't schedule an 8-hour meeting or watch your grandchildren the next day. Yeah, give
Right.
yourself a minute just in case you need it.
Right.
That's great. No, I'm still laughing because I have some of those superstitions too, and you kind of hit on a couple of them,
Yeah.
so I was smiling about those.
No, it's funny. I've heard of people who've like picked out all the movies they're going to watch all day long. They make like this. I mean, I wonder almost maybe if you don't have the side effects, you're disappointed because you planned this whole pampering day in bed.
Yeah.
But I think go for it, something like that. Sometimes it makes people feel better to have kind of a down day planned just in
Yes,
case, kind of where you can
that's
pamper
me.
yourself a little bit. Yeah, might do it. We should all probably do more of that. That's probably what that means.
Yeah, if you can, right? That's
Yeah,
doctor's orders, right? Now everyone
that's
heard
right.
doctor's orders. Kind of pivoting slightly, still focusing on getting the vaccine, but are there any timing issues with IVIG therapy and getting the vaccine? We had a couple questions come in during this session about it.
No, that's a really great, also a really great question. And I would say that at this point, we don't have any across the board information to suggest that timing it around your IVIG makes a difference. IVIG, again, in contrast to other treatments like plasmapheresis or plasma exchange, which truly filters the blood in certain ways, IVIG is just something that you're receiving as an extra infusion. And we do not have any indication at this point that it is definitely something that would interfere with the immune response from a vaccine. That being said, I think that if you have a choice, and if you're getting routine IVIG treatments anyway, it may make sense if you can schedule it, right after a treatment or in between treatments, depending on how often they are, that might be something to do just in case, but we certainly do not have any information right now to suggest that it's a definite problem area.
And another question that recently came in is more about, right, I mean, there's lots of vaccine supplies that are diminished. It's hard to get them. It's hard to even schedule your first dose. I can speak to us here in Chicago. It is hard to get it. But what if you get the first dose and then you can't get your second dose until 3 or 4 months after that because there isn't a supply available for you? Is that a concern when it comes to the efficacy of the vaccine? Should you still get the second dose even though it's 4 or 5 months later, or thoughts on that?
So I think this is a debate that in various ways is of course playing out on a global stage, for better, for worse, in recent months, where we've seen some countries are so fearful, I think in the UK or in Europe, that they're wondering about even having strategies where they say we're going to wait on the second doses for everyone and get as many people the first dose as possible. And that's for a reason. So that's because we, again, as we mentioned earlier, because we do know that the first vaccine does show some efficacy, which has been scientifically proven after you get several weeks out from the first vaccine, that people actually have a significant amount of protection. And we're talking about the vaccines that require 2 doses, the Moderna and Pfizer vaccine. So certainly based on that, I would not be, I think ideally, of course, we want to abide by the guidelines and try to get the second dose if we can at the timed interval. But if it's truly, there's barriers and you're not able to, I would certainly go ahead and not be concerned and go ahead and get the second dose when you're able to, even if that's longer than the initial recommended time frame.
Great. Well, those are the majority of the questions that we received on the vaccine, but there are still so many questions about COVID-19 and peripheral neuropathy in general, so I'm going to pivot a little bit to that right now. And some of these you kind of touched on, but I kind of want to bear in a little bit more on it. So is there any indication that you know of right now that COVID-19 can impact either the central or the peripheral nervous system?
So at this point, unfortunately, we're about a year into the pandemic, but because of this, we also have much more information because we've been able to see millions of cases and a lot of different effects of COVID on patients. In terms of the central nervous system, meaning the brain or the spinal cord, I think that one of the, there's a number of complications. I think that the majority of these complications are rare. So what I'm about to describe is rare. These are not common complications, but we've seen some patients who have seizures. These are normally patients who are in the hospital with COVID-19 with severe illness. We have seen some patients who have an increased risk of strokes, even in people who have relatively few stroke risk factors. We think this is probably related to the fact that they've seen that in some of those patients, they have a higher risk for clotting it systemically, not just in the brain. Now, bear in mind that some of this data also came out really early in the pandemic, and now we have treatments that we didn't have at that time, and our options that hopefully will prevent some of these more severe complications. We also see patients who are not hospitalized who describe sort of a post-infectious brain fog, if you will, for lack of a better word, where they notice trouble with concentration or memory, even for weeks or even months after they've recovered from the illness. And this is something, we see actually, even though it feels very fresh now, when you look back, we actually see this in other viruses. For certain other viruses, mono is probably the most famous one that people think of, where people have prolonged fatigue and kind of mental malaise, if you will, afterward. So this isn't something that's totally unique. It's just something I think that we haven't seen, especially at this level across the population, in a very long time. In terms of the peripheral nervous system, some of the complications, which again are not the most common or are rare, but we are seeing, especially now that we've had millions of cases, include things like Guillain-Barré syndrome, which can be like an acute inflammatory neuropathy. We see this again as a reaction even against other viruses, like I mentioned, but we are seeing some cases which seem to be linked to COVID-19. In some cases, we see also patients who may have other problems with the nerves bundle in the shoulder and upper arm area known as the brachial plexus, where some patients seem to have either inflammation in the brachial plexus, and some people are debating whether for some patients who were prone, who were hospitalized for a long time, if it may be more of a mechanical injury from being prone in order to save their respiratory system. So this is, again, these are rare, kind of more severe sort of symptoms. Some of the symptoms that we are seeing more commonly for patients who were not hospitalized, but maybe were sick at home and then have lingering symptoms afterward, fall into this. So you hear this in the news or the media, they call it kind of long haulers or chronic kind of symptoms. And this is an intense area of research right now to try to identify what this means. But those patterns, sometimes we are seeing pain, body pain, or numbness or tingling. Some of these patients, they think may have actually a type of small fiber neuropathy. Some patients, all of their neuropathy tests come back negative, and we don't know exactly where that's coming from, but it's definitely real. And then the fatigue and cognitive symptoms, like I mentioned. All of these things also, I think, just to bear in mind and to take it back to the vaccine discussion, these are rare. I think, but they're also in some ways part of the risk conversation when you're debating even if I get a couple days of side effects after the vaccine, it's worth it. I think for most patients, as opposed to looking down, and being worried about the possible risks of COVID itself.
And we earlier in the session, we talked about the vaccine and the potential, heightening of peripheral neuropathy symptoms following the vaccine, whether it's the first or second or both doses, depending on, again, which brand you get. Now going back now to just COVID-19 and the actual disease itself, can that cause or make symptoms worse? So let's pretend I don't want to get the vaccine, I'm going to risk it. And then tomorrow I contract COVID. Is that going to make my symptoms worse forever, for a small period of time? Is there data that can support that kind of claim?
So we do not have information that that COVID infection for patients who have pre-existing neuropathy that it makes their neuropathy worse. That we do not have. But what we definitely know is that for a number of patients, even who do not have a history of neuropathy, or maybe they already had neuropathy, so it's independent of that, that it can actually cause neuropathy type of symptoms, pain or burning in your limbs. Some of these patients, again, have testing for neuropathy and the tests are negative. We still treat the symptoms the same, and many patients do get better with time, but it is possible. I mean, if you can imagine, if those are symptoms that come up in patients who don't even have neuropathy, that for somebody who does already have neuropathy, it's definitely something where patients may feel like their neuropathy is worse because you're having sort of layers of similar symptoms on top of each other.
And it's scary. It's really scary for people. And we speak to a lot of different people that call us here, email us at the Foundation for Peripheral Neuropathy, and they're scared. So I think this session is really great because I think at the end of the day, people should know they're not alone, and to always go seek, more advice from your neurologist to really hone in. There's got to be exams. And I think that kind of leads into the next question, or what kind of options do patients have if they contract the virus and now it's either caused new or worsened existing symptoms? What should these patients do other than the obvious?
Sure. So I think, I think that if you're having these sort of symptoms, certainly I would talk to your doctor. So you're not alone. This isn't meant to be something that you try to figure out and battle through on your own. So please, reach out to your doctor. And if needed, certain people, even if they didn't have a neurologist before, we're seeing many new patients for post-COVID symptoms.
Right.
And so please, make sure that you're partnering, that you're not trying to battle this out on your own, because it can be scary. And as new as this is, I can say, unfortunately, there's a lot of providers, especially I think in larger urban areas in particular, who unfortunately are getting a lot of experience working with patients like this. And it can be helpful to feel like, oh, okay, like I'm not the first person this has happened to, or we have some information here, which we do. So that's what I would say from a patient perspective. Please do that, because there are things that people are looking at, and it's too early to have a lot of sort of scientific papers and true kind of data, if you will, but we are seeing anecdotally that there's certain things that really help patients. For some people, they're talking about different anti-inflammatory vitamins that help them feel better. Certainly, it may sound boring, but hydration and rest, extra rest, especially if you're having some fatigue and following a COVID infection, is critical. And then for some people who have more severe symptoms, the same neuropathic pain medications that we prescribe for patients with neuropathy, we're using these for some patients with post-COVID neuropathic pain. For some patients, they feel like steroids really help them. And for the rare cases where people do have a Guillain-Barré type of autoimmune response, which is again very rare, but we have seen it like we do see with other viruses, that is sometimes treated sort of urgently with IVIG or other treatments.
So it sounds like, and again, just to kind of sum it up so that I understand it correctly and that our viewers also appreciate what you're saying is, so if you contract COVID-19 and you have neuropathy, your symptoms are getting worse, you should definitely go see your doctor, your neurologist, discuss it with them. You should consider taking some additional supplements, which may or may not help with those symptoms. Water is always good, right? In life, we need water. So try to keep hydrating and look for some other medications that may or may not help some of the pain that you might be experiencing, similar to what you would do even if you didn't contract COVID and your symptoms are worsening.
Correct, absolutely.
And I just kind of want to also highlight the fact that here at the Foundation for Peripheral Neuropathy, we have support groups throughout the country, even throughout the world, that are there not just for COVID specific questions such as this, but that are there to support each other. It's really a community. We have lots of local support groups. The majority of them are still operating virtually for the safety and well-being of each other. But I think these are really great opportunities, I think, for patients just so that they don't feel alone because I think that is really one of the more scary things about this pandemic is you feel like you're alone, and if your symptoms are worsening, you don't know what to do. But this advice is fantastic, and we'll definitely continue to relay this to our patient population. So thank you.
Absolutely, and I think that one thing to also mention is this is an extremely rapidly evolving area, and so what we've just spoken about now, we might have new information,
Tomorrow.
even if it's anecdotal, based on the next 100 or 1,000 patients tomorrow or next week or in a month. So there are things that are changing, but even more so, I would say it's a good reason to make sure you're reaching out and getting help.
Yeah, stay connected, reach out, and take any offers you can. I think that's just general perfect guidelines for being a human being. I think it's really showed us that we can all come together and get through it, and we evolve, we figure stuff out. So we'll all get through this together, and that's what I keep trying to tell myself, at least. So that's great. And then they're kind of going back again to COVID. Do you think that patients who already had peripheral neuropathy, right, our current population, do you think they're considered at any higher risk for suffering from ongoing or detrimental effects from COVID?
We don't have any definite evidence to show that.
That's great news.
Yeah.
So it sounds like COVID just is not good no matter who you are, but if you have peripheral neuropathy, you're not at a worse level, so to speak, when it comes to some of the effects or symptoms that you might see for the rest of your life.
Correct.
Great. Well, thank you everyone who has already shared a lot of their questions relating to this topic. I think we've covered the majority of questions related to the COVID-19 vaccine and COVID itself, the coronavirus. So I wanted to kind of pivot a little bit, just again, going back to what this webinar is all about, which is managing your peripheral neuropathy amidst a pandemic. Recently, we did a webinar on telehealth, and I just wondered if you had a quick summary of kind of the big highlights from telehealth and what patients are doing right now to help manage their neuropathy. So they're still seeing their doctor, but they're taking care of themselves. And if there's any new updates you wanted to share since that last program.
Absolutely. So, one thing I think that we are learning and that we're seeing not just in medicine, but across many different areas of society is that the use of these remote technologies that we've all become maybe too much inundated with, for better or for worse, over the last year, to a certain extent, I think will be available going forward. So in medicine, there's some discussion that telehealth was certainly around before the pandemic, but we expect at this point to see it persist. It will become probably more of a balanced combination for a lot of different venues where you will have a lot of in-person visits also, but that there'll be opportunities to use telehealth for a quick follow-up. So I think for some of my patients, like now, if at all possible, if I'm seeing a new patient for the first time, I really want to try to see them in person, if at all possible, so I can examine them and really get the full neurological examination. But if it's a patient who's established, who we've known for a long time, and we need to review some quick questions or their medications, we'll set up a quick video visit. So we can do a telehealth encounter. We can actually see each other. We can go over things in more detail. You can definitely accomplish certain basic parts of the exam through telehealth, as we discussed before. So trying to engage in telehealth when you're in a private space, ideally a place that's as quiet as possible, where you have a little bit of space if you need to kind of stand up or walk around or show someone your foot, things like that, if at all possible, can be helpful. So I think that we'll continue to see, especially even as the pandemic eases, a continuation of telehealth, but really incorporated thoughtfully as sort of a hybrid model, if you will, with sort of more traditional in-person care. And certainly I think it will be something for patients, that should really be a matter of convenience. So if you prefer to come in person, great. And if you prefer to have follow-up visits, the other way, I think many settings, many providers will continue to offer that. One thing that may change, especially for patients who may have moved around the country or different states during the pandemic, is that we do expect that as the pandemic eases, that we will stop seeing the sort of broad allowances between states with medical licenses that were happening during the height of the pandemic, where a physician who was licensed in New York could have emergency privileges in New Jersey and Florida and Connecticut, just as an example, because many of their patients were now located in these states, and normally we wouldn't be able to practice there, but for telehealth purposes, to take care of our patients, we were. So we're starting to see that some of these restrictions are lifting, which may just mean that there's going to be more of a focus on you receiving your telehealth, at least when you're physically in the same state as your physician. So for some people that may not, prove an issue, but for some people they might, that might have, you might start receiving new questions about what state you're located in, much more so than we were doing last year, and that's the reason why. But I do think that it's something that certainly I still have patients who may not quite be done with their vaccinations yet, and we're still doing telehealth. I have patients who are comfortable coming in person, who prefer coming in person, and patients who it's still very convenient for them to be able to have follow-up visits as needed urgently through telehealth. So I think that it will kind of be hopefully a positive new element that will be able to incorporate this more thoughtfully going forward in a way that benefits patients who want it, including neuropathy patients.
How do you measure a baseline with and without telehealth?
So that's, I think, an excellent question. Imagine, and this varies, I think, widely, across different specialties. So it goes without saying, of course, if somebody has maybe, if you're seeing a psychiatrist and the bulk of your visit is really about having an in-depth discussion, you can pretty much accomplish everything through telehealth. For patients, especially with neuropathy, because there are nuances of our physical exam and sometimes getting, other testing like an EMG that you just cannot do through telehealth, even if you can do most of it, you really can't do all of it. That I think many, if not all, of the neuropathy specialists that I know really prefer to see new patients now in person at least once to get that baseline. And then once you have that, then I think there's more flexibility. Needless to say, if there's an emergency situation and the person just can't come in, then that's fine, that's different, but it is really hard to get that baseline. And when we were in the middle of a horrible surge in the pandemic, that was one thing, but now I think, increasingly we're seeing that the COVID numbers are decreasing, that there's a lot of widespread safety measures that are certainly well implemented now in healthcare settings. So we really are encouraging patients for that reason, especially to get that baseline. Sometimes it can make the whole difference for your diagnosis. And that's huge. So I think especially for the first time patients, we are really trying to focus, and I think many neuropathy specialists are trying to focus on having patients come in at least for that baseline new patient visit in person.
And similarly, I mean, there are other diagnostics and tests that you would potentially need to do physically, right? Are there any tests that are there any blood tests for neuropathy patients? I think that's like another very common question is, can someone take my blood and find out if I have neuropathy, or is there another test that I can take that proves that I have this symptom, that I'm in pain and it's caused by neuropathy? I think that's another thing that patients are trying to figure out. Is it worth my visit, my risk and my visit to leave my house, go in during the pandemic to see someone to have various tests and what those tests would look like to better understand what I'm dealing with, so I can say, see, look, this is what I have, and now this is how I'm going to figure out what to do next.
Absolutely. So those are great questions. Definitely also very, real questions that we deal with all the time. So I think that there's, it depends. So I have some patients who don't want to leave their home. They don't want to leave their home to get their blood drawn, and they don't want to leave their home to come into the doctor's office. And I definitely have some patients where we've said, okay, we would like to check these blood tests, and we're going to just wait and make a note of it. And we're going to revisit it in a month or two, and sort of reassess where we are. And so for that, that's okay. There is no real blood test or test you can do at home, that really provides kind of a clear-cut diagnosis for neuropathy. We can certainly have a conversation and do some things and say, we think it sounds like you probably have neuropathy. But honestly, to get the full characterization, it's very helpful to have at least an in-person examination by a physician who specializes in neuropathy or a neurologist. For some patients, an EMG is really essential. For some patients, having these types of tests can help determine not just that they have neuropathy, but what type of neuropathy they have. And that can sometimes even shift different types of treatment options. So it's something that, again, if it's something where we prefer to, and we want to wait a month or 2 months or what have you until the timing is better, that's, I think, that's for most patients, that's completely fine. Because for the most part, and I think most of the people here will probably agree that for the most part, most types of neuropathy do not change kind of overnight. If they do, then you definitely need to seek urgent medical care. But for the most part, it's something that's waxing and waning, that's a slower moving issue. And so if you're waiting a little while to kind of finalize things, that's usually okay. And I think that probably most patients who feel like their symptoms are really escalating quickly would probably also feel more of a sense of urgency about, okay, how do we risk this, or do we get a special mask, or whatever the case is, to feel more comfortable coming in. For blood tests, I've definitely had some patients, like I said, if they really feel uncomfortable coming to the doctor's office, they don't want to go to physical therapy, they don't want to go to get their blood drawn. And so it kind of usually goes hand in hand, because they just don't want to be in these sort of healthcare environments, no matter what it is. There are definitely certain blood tests that we routinely check, especially as part of a routine workup, in particular to look at for things that are relatively simple, that can be easily corrected, that can commonly cause neuropathy or neuropathy symptoms, like diabetes or borderline diabetes, thyroid dysfunction, or certain vitamin deficiencies. So those are things that, if it's a new diagnosis of neuropathy and you haven't had some of those blood tests done recently, we always want to check those, because sometimes we're able to identify an imbalance that can be corrected relatively easily, that actually might help stop the progression of, or even reverse your neuropathy symptoms. But I work with each patient individually, and I think most people would have the same response as, what is your comfort level? And if you're not leaving your home for medical visits, some people may or may not be comfortable going to get their blood drawn either.
And this might be an awkward question, but I think we hear of a lot of patients that say they're not getting the time of day from their current physician in answering questions, or similarly, their telehealth experience hasn't been what they wanted it to be. They're not getting the attention. They get a very short visit. They don't get all of their questions answered. They're somewhat dismissed. Typically, we at the Foundation for Peripheral Neuropathy say, look, you need to find a physician that will give you the time, that will spend time with you, answer your questions. But you're a neurologist. What would you recommend a patient do if they either don't like you or they don't like someone else? And, I think at the end of the day, we're trying to make sure the patients get what they need. But sometimes their hands are tied. And do you have any suggestions or advice in general, again, amidst or not amidst a pandemic, what people should do when they're just not getting the answers and the care that they're seeking?
So I think, again, I think to your point, this transcends whether or not we're in a pandemic or not, absolutely. But I think it's really important, it's not for nothing that this whole discussion of the provider or physician or doctor-patient relationship is a concept that has been talked about or written about or thought about for millennia, because it is so foundational to treatment, and I think to successful treatment. Some might argue if you need surgery, as long as you have a great surgeon, like that may be different. Some people would say that's still not different, but certainly if all of your care is really about communication, there are so much research, believe it or not, that actually focuses on how having a good relationship with your physician can actually makes your treatment course better. It may not change your condition, but it certainly can have a very powerful impact on what your experience is moving and working with that condition, your ability to kind of understand and work through different treatment options and so forth together. So I think it's very important. And I think, it is kind of as you say, it's kind of a funny thing. I don't personally find it an awkward question, but I think that because of that, it's important that if you really feel concerned that's a relationship is not working for you in the way that you need it to, I personally think it's fine, to look and see if you can find somebody where that does work. And sometimes people may be equally qualified, quote unquote, on paper, but it may just be that you have a better sort of sense or relationship or whatever the case may be with one provider versus another. And in some ways, for some patients, I feel like, or for patients who have harder access, to different specialists, I feel like that may be one of the benefits to telehealth if you are able to go in periodically to see someone in person. But if it's, too far of a commute to go in for regular appointments, but some of those now can be through telehealth, that also might open up new avenues for you to look for different types of care if you feel like that's something you need.
Yeah. No, that's great. And as I said, it was a little bit of an awkward question, but I think it's important that the relationship is key. So keep looking for that perfect doctor, that perfect someone, because they're out there. There are a lot of good neurologists. Dr. Patterson, I think you're one of them, and we're pleased to have you on our team as well. But if you can't find one, we have some directories and lists of neurologists that we've heard of other patients' recommendations. So contact us here, and we'd be happy to see if we might be able to put you in touch with someone that we think would be a good fit as well. But at the end of the day, it's everyone's decision, it's everyone's opinion, and it's tricky, but especially when people are a little bit more alone amidst the pandemic, it's all that much more important that you get the health care that you need and you deserve. Well, in wrapping up the session, I actually didn't want to ask another question. I wanted to ask more of an open-ended question to you, in the sense of, do you have any other advice, thoughts, feedback, must-knows to our patient population out there, things that you think everyone should know but maybe doesn't know?
Oh, wow.
Yeah.
That's a great question. I feel like our people joining us are so well informed, so I can't say that for sure that there's something that that I know that they don't know, because I feel like people here with us are probably very well informed. But I think one thing that I find that we've been talking a lot about that I think is worth mentioning is that the importance of self-care, and I know that there's been a lot of twists and turns. It's been a very stressful year for people. I think for different people, depending on where you live or where your loved ones live, it may be a year since you've really been immersed in the pandemic, or even if not, it's certainly not much less than that. And that I think just not to discount the importance of that. I think that and the way that stress can kind of creep up on us, I think that many people find it easier to think about kind of emergency situations when you're really in the height of something, like in the middle of a horrible surge of COVID. But to be sure, there's a lot of research that's shown, and we're seeing a lot of this right now, that this has a way of gnawing away at us, and that knowing that the effects of this kind of can potentially gnaw away at you, where you maybe feel a little more fatigued, or a little bit more on edge, or a little more irritable. Mm-hmm. And some people feel like, where is this coming from? This isn't me. Why am I feeling this way? Things are kind of getting better now, and that's normal. Mm-hmm. It's totally normal. It's a normal reaction to chronic stress, to be quite honest. And for many people who've had, unfortunately, friends or colleagues or been experiencing really severe kind of COVID or lost friends, this is a true trauma, and it can take time to recover from that, and that is normal. So I would just advise people to not to dismiss that, not to feel like if you're having any of those feelings that you're feeling, that that's strange or unusual or wrong, and that it's still definitely a time to take care of ourselves, really kind of emotionally and psychologically as well as physically, and that there's no doubt that also our emotional and psychological health has a profound impact on our physical health.
Mm-hmm.
And so I think these things go hand in hand, but this is still a time, certainly not for everyone. So I don't mean to say that everyone should be feeling this way, but we definitely see it obviously in healthcare and in New York City, but we obviously we talk about this a lot, and that it's really important to take care of yourself, think about ways that you can kind of give yourself the space that you need, if to take care of yourself also, whether it's through exercise or rest, finding things that you enjoy, hobbies, connecting with loved ones in whatever way is safe for you right now. And then just to remember that. And obviously, if you're feeling really anything more significant, that reaching out also for formal mental health care, which as mentioned is very, very commonly available now through telehealth and easier than ever to get access to. It's very important. It's very normal. And so I just wanted to acknowledge that.
Yeah, no, and I appreciate that. I echo those words as well. And there are so many other questions that I could ask you about symptom management and other causes and how to best exercise in the pandemic, things of that nature. But unfortunately, our time ran up. We thank you so much for your time, Dr. Patterson. We look forward to another session where we can ask you many more questions that were logged in today and we just didn't have the time. But so until then, thank you again. We really appreciate your time and expertise. And again, thank you to everyone who watched us today. Following this webinar, we will be sending out a survey. We encourage you to share your feedback with us, whether it's positive or negative. We value everyone's opinion so that we can make sure that our programming, such as this one today, can continue to thrive and continue to answer the needs and questions of our patients. We also hope that those of you watching or those of you watching later on the recording, we hope you will continue to support us so that we can continue providing these types of programs. And as always, the Foundation for Peripheral Neuropathy is here to help you. If you need us, feel free to email us, call us. We're here. We're small, we're mighty, and we're really thankful that that we have you all as a community. So again, thank you so much, Dr. Patterson. Thank you all who have joined us today. And please continue to take care of yourselves, stay well, and we'll see you soon.
Thank you, Lindsay. Thank you, everyone.
All right. Bye, everyone.